You asked some questions, here are my answers, starting with this. Are we all dehydrated and should we be drinking more water? And what can it do to your body and mind? Thanks for the question. The answer is no. I don't believe we are all dehydrated. Our kidney system for controlling our fluid levels is super sensitive and very hard for you to ignore. If you get that dry mouth, that lethargy, that headache, leading to organ collapse and low blood pressure and dizziness, it's impossible to avoid drinking more water. That 8 glasses a day, I think it's a little bit of a myth. It depends completely on your age, your gender, your activity levels, amongst so many other things. I've just turned 50, do I have to have a prostate examination or not? I think the answer depends. If you have prostate symptoms, which are trouble with the water, getting up at night, slower flow, dribbling at the end, then go to your doctor and have a chat. But I think what you're getting at is, all that's happened is you've changed age, you've turned 50, no symptoms, and should you just get a routine check? Well, there's a reason that we don't call you in, and that's because screening doesn't work in prostate cancer. And if the test you're referring to is the digital rectal exam, that's where we put a finger in the back passage to have a look, it's not very good at all. So go to your doctor if you have symptoms, or if you want to talk about things, but it's not strictly necessary. How to cope with chronic pain? Oh God, that is a hard question to answer. 1 in 3 people in the UK suffer with pain on a daily basis. And I really don't have this is the obvious answer for it. What I can say to you is do a couple of things. First of all, understand that it's not just all in your head. I know that as healthcare professionals, some of us are guilty for saying, well, we can't find anything wrong with you, it must be just you. That's not true. Pain is very real, so you have to accept that the pain is real. But secondly, if no diagnosis has been found, you have to accept that this is chronic pain without an issue, because then you can move on and learn to live with the pain rather than expect completely getting away from it. This is a huge topic. The closest I can give you is my videos on fibromyalgia. That's a pain condition where I talk about this in a little bit more detail. Do you think it's possible to come off insulin, type 2? Good question. For context, type 2 diabetes is the type where you can make your own insulin to keep your sugar levels down. The problem is your body is resistant to it, meaning you need more of it, sometimes as an injection. And the reason that people become resistant is usually because they are overweight. So you lose the weight, you become less resistant, meaning you need less insulin. So yes, it is technically possible and has been done with the UK Direct trial, where through rapid weight loss and dieting, half of people's diabetes were put into remission. So yes, it is possible, but never just stop your insulin, always go by medical advice. Sensible weight loss and exercise tips for unfit 50-year-olds like me. I've lost 5 stone and still have quite a way to go. How to cope with stress eating would be really helpful too. First of all, you're the one who's lost 5 stone. You're the one who should be giving us advice on how to lose weight, because what I do know is it's extremely difficult, and the only way to lose it and keep it off is to really do it slowly, not by crash diets, cutting out calories. Although that will work, it's not a long-term solution. You end up putting on the same, if not more weight with time. So I would say consistency, not intensity. Eating until you're full, but eating the right meals, and over a long period of time, maybe even years, the weight will slowly come down. With regards to stress eating and losing weight, I've got 2 or 3 books that are really good that I'm going to put in the description down below. So this one's about needing dairy to make iodine. And if we don't have dairy, does that mean we're all insufficient? You might have noticed that the first videos I made on YouTube were about hypothyroidism, an underactive thyroid. And for that condition specifically, iodine is super important. So we need iodine for our brain function and for our thyroid function. In some countries, iodine is added to salt and tap water, but not in the UK. So the most common source of it is through dairy. It can be gotten through other sources, like I think especially white fish. But if you don't have that white fish and you don't have dairy, there is a real risk of being iodine deficient, and it is starting to creep back into the UK. So I would say if you don't get any of those in your diet, it's worth at least considering taking iodine supplements, yeah. Does leaky gut really exist, and can it trigger autoimmune disease? Yes, leaky gut does exist. In the medical world, we call it increased gut permeability, which basically means that things can go across the gut wall easier than they should do. And with regards to its connection with autoimmune disease, there is a connection there. But what we don't know is chicken or the egg. We know that autoimmune conditions like rheumatoid arthritis, inflammatory bowel disease, celiac, those people often have increased gut permeability, this leaky gut, but we don't know which caused which. What we do know is if we treat the autoimmune conditions, the leaky gut can often get better too. Is it worth getting your testosterone level checked after 70? And does testosterone level affect your blood sugar levels? With testosterone, our testosterone naturally drops by about 1% a year after 30. And just getting it randomly checked, what are you going to do with the result? It depends whether you have symptoms. So go back to how you feel and your symptoms, and if you've got symptoms of low testosterone, then go and get it checked. Now there is the second part to that question, its connection to diabetes. We find that a lot of people with type 2 diabetes tend to have low testosterone. So in that situation, it's worth considering because we found that increasing testosterone levels can slightly, very slightly, reduce your HbA1c. That's that blood sugar test that we use to monitor diabetes. You know I've got a video on low testosterone, so maybe give that a watch too. This one's about bloods and scans and how quickly the GP can analyse the data. I can only really comment on the UK and the NHS and what happens, and there are variations between practices and hospitals, but this is typically what happens at my practice. You go in and have your blood test, the blood test gets transported to the lab that day or the following day. The result comes back with most blood tests, the standard blood test that day or the following day, and then the GP will see it usually should see it within 24 to 48 hours, but it can take a bit longer if you're at big practices that are under a lot of pressure, maybe 4 or 5 days, and at that point they will have actioned it. That doesn't necessarily mean they've picked up the phone and called you. It means they might have gone, yep, it's a normal result, no action needed, but they will contact you if it's abnormal. Things can happen a lot quicker if it's a really bad blood test. Often the lab will pick up the phone and call the GP the same day, and within 24 hours it might be acted upon. But scans are different. It depends on the type of scan and where you are. Some scans are quicker to interpret, but when you have your X-ray or your CT or whatever it might be, the images go to a radiologist, and then the radiologist has to interpret it and send it to your GP, and then the GP has to see the report and interpret that and take action on it. So that could be anything from a week to a month. Contrast and MRI, how bad is it? So contrast is this chalky chemical that's injected into the veins sometimes when you have an MRI scan, and the purpose of it is to light up on the scan, making it much easier to see specific parts of the scan, basically. And it is extremely safe. It's 1 in 10,000 people who have an allergic reaction to the contrast, and the most I hear is that they feel a bit funny when it goes in. Some people feel like they want to wee, but otherwise it's fine. The exception is if you've got bad kidneys, so severe kidney failure or end-stage renal disease, it can be a bit nasty to your kidneys, but your doctor and the radiographer and the radiologist will know about that before you go and have it done. This one's about epidemiology and whether it's a fraud, whether it's a real form of science, and whether it weighs statistics properly. So for people who don't know, the best way I describe epidemiology is the science or study of trends in the general population. And I think it's a bit harsh to say it's a fraud because it has had its successes, like recognizing the connection between smoking and lung cancer, folic acid deficiency and spina bifida in children. But there is a flaw to epidemiology, and that's finding connections that aren't there, which can lead to news headlines which aren't a good idea. So epidemiology isn't a study that finds real connections. It's a compass that points you in the direction to do a quality study to prove it. That's the way to use epidemiology. That's all I've got for today. Make sure you join my free 3 Apples newsletter linked at the top of the description box below. We can have some over and back conversations. I'll give you a newsletter once a week that's small, easy to digest. Put your new questions in the comment section below. I hope that was useful, and if it was, likes, thumbs up, subscribes, and hopefully we can do it again sometime. Thank you. Bye-bye.